Hi, Joan. Thank you so much for being here.
Hi.
Okay, so what were your first symptoms of vertigo before your treatment?
Well, about 30 years ago, I woke up one day and was super dizzy and didn't know what it was and went to the ear, nose, and throat clinic at UAMS and saw Dr. Dornhofer. And that's when that Epley maneuver had just come out and people were starting to do it. And they did it and it corrected it that day. So it was quite impressive. Before that, I think people just took vertigo medicine and dealt with it. And that lasted about 10 years. And then I had a little flare up and I went back and they did it again. And so that was probably 20 years ago. And then about 10 years ago, it just had developed where it was only positional. So if I put my head back or if I put my head forward, I would get dizzy. Or if I got up from a bed too quickly, I got dizzy. But, I had to sit there for a minute for everything to clear. But I could deal with it, and my quality of life was okay because it was mainly positional, and I could avoid the positions that caused it. Although sometimes I would get up from something and look a little off balance for a minute. And that went on about 10 years. And I tried to do the Epley at home, but it's very difficult to do it yourself. And I know I wasn't doing it, especially after he did it, I knew I wasn't doing it effectively. And I figured since those crystals had been out so long, and I was almost 70 years old, that I'd heard they just don't go in that easily once you're older, or the crystals are older. So I sort of felt like I was going to have to deal with it the rest of my life, which wasn't a big deal, but I was getting ready to have a major back fusion surgery. And I knew that it was extremely important that I not fall after my surgery. So I had gone to Brian because I just wanted to get stronger heading into my back surgery. And when I told him about it, he said, well, I can fix that. And I'm thinking, well, I've tried and they've been out 10 years. But if you want to try, try. And I knew, so I set up an appointment to have it done at the club. And I knew when he was doing it that he had hit the sweet spot. I mean, I knew exactly that he had my head in the right position. And I just could tell it was a whole different level of expertise doing it.
Oh, wow, that's great.
And I was great after that. And then I had my back surgery. I had lots of complications from the back surgery. I was actually on a walker for a month and was not walking well at all. And I really think if I had not had it corrected, I would have had a terrible time after my back surgery, trying to stay steady on my feet and learning to walk again, literally. So I so appreciated him fixing it.
Wow, that's awesome. That's so cool. So how quickly did you get the recovery from the
Oh,
treatment that Brian did? Was it the
I
same?
knew immediately. And the
Oh,
next
really?
day I was totally normal. Mhm.
Wow.
I'm starting to just barely, I can tell, get a few crystals that are floating around. It's been 6 months or almost 7 months. And I'll probably, if it gets a little bit worse, I'll go back and have it corrected again. It's just not, I mean, it's so subtle right now. If I didn't know what I was feeling, I wouldn't think it was anything. But he'll fix it again if I need him to.
That's awesome. So what would you say to somebody who's maybe thinking about maybe like on the verge, I don't know if I should get treatment or not. What would you say to somebody like that?
I think there's absolutely no reason not to. There's no downside to it whatsoever. I mean, if it doesn't work the first time, I'm sure he'll try again. And I was convinced after 10 years, my crystals were not going in that easily. But I just think there's no reason not to do it. It's not like you have to be put out or he can screw something up, or if the worst scenario is, I guess, if it doesn't work, but he'll do it again and till it works, you know. No, and it's not, I mean, Medicare did not cover it, which I think it was 200 and something dollars. It was not expensive in the whole scheme of fixing something. You know,
Right.
I thought it was worth every penny of it. And even if I hadn't had back surgery, I was still thrilled to have it fixed. Like I was a golfer before my back surgery. And every time I would bend down to pick up my ball out of the cup, I'd get a little dizzy. And, you know, that wouldn't happen now if I was doing it. So.
Right. Well, that's awesome. Thank you so much for sharing your story. We really appreciate
You
it.
are very welcome. He is just wonderful and he's so nice to work with. I'm just crazy about him.
Good. Thank you so much, Joan.
All right. Thank you. Bye.